A 22-year-old woman who was addicted for a long time to intravenous heroin is admitted to the hospital because of loss of appetite, anorexia, weight loss, and peripheral ankle edema. She looks chronically ill and cachectic, that is, wasted. Blood pressure is low at 88/56. Heart rate is fast at 105, and she's febrile at 39.5, normal being 37. Her sclerae, the white of her eyes, appear slightly jaundiced, and when you listen to her cardiac exam, you hear a grade 3/6 holosystolic blowing murmur heard over the sternum without radiation. So let's imitate that. Here's the normal heart sound, lub-dub, lub-dub, and here's this girl over the sternum. We hear lub-dub, lub-dub, lub-dub. And this is the murmur of tricuspid regurgitation, similar to the murmur of mitral regurgitation, but the mitral regurgitation murmur is heard best out here at the apex, and the tricuspid valve is heard best over the sternum. She has an enlarged liver, undoubtedly heart failure with congestion, and 2+ peripheral edema. And her blood bilirubin levels are elevated, saying that there is hepatic congestion and damage to the liver. And unfortunately, her blood cultures grow Staph aureus, which is one of the resistant forms, the so-called MRSA. So what's critical here? Of course, the history of intravenous heroin abuse. The needles aren't sterile. The heroin's not sterile. She has symptoms that suggest an infectious process. She looks chronically ill, so this has been going on for a while. Low blood pressure, high heart rate, a temperature. She's got signs of hepatic disease. She's a little jaundiced. Her bilirubin is elevated. She has an enlarged liver. She has heart failure because of 2+ peripheral edema. And she has a murmur that suggests tricuspid regurgitation. And we've mentioned this before, the elevated bilirubin numbers, and of course she's growing staph. So the first test would be an echocardiogram, and this shows a large vegetation on the tricuspid valve. No surprise, because she's been injecting non-sterile material into the vein and then into the right side of the heart. The diagnosis: tricuspid valve vegetation, endocarditis, secondary to staphylococcal aureus. So we start intravenous vancomycin. She gets that for 3 to 4 weeks. She has a tricuspid valve replacement with a porcine heterograph, that is a tissue valve. She gets drug addiction counseling in the hospital. Her intravenous and antibiotic therapy and intense behavior modification therapy for her addiction continue after she leaves the hospital. And she's told that a repeated infection to her prosthetic heart valve will almost certainly result in her death, and that really injecting heroin again would be very likely fatal.